age. It's the news none of us want to hear. The number of COVID cases is on the rise again, and so are the fears about something called long COVID.
Yeah, we've heard a lot about this. It's a condition where people experience long-term effects following an infection. Our National Verified team is answering some of your questions about the virus.
Nearly 90 million people in the U.S. have tested positive for COVID-19 since the pandemic began. Some of those people continue to experience symptoms or complications for months afterwards. It's a condition called long COVID. Several Verify readers have emailed the team with questions about long COVID. So let's answer them using these sources. First up, what is long COVID? According to the CDC and the Mayo Clinic, a person is suffering from long COVID if they continue to experience symptoms more than 4 weeks after their COVID-19 diagnosis. The WHO adds that symptoms of long COVID last for at least 2 months and cannot be explained with an alternative diagnosis. So how do you know if you have long COVID? According to Dr. Ilham Masaoudi Powers, an immunology expert at the University of Kentucky College of Medicine,
unfortunately, there isn't a really good way to test for long COVID, right? It's all subjective and it's all people reporting their symptoms.
So what are some common symptoms of long COVID? The CDC says that many long COVID symptoms are similar to those caused by an acute infection of COVID-19, like joint or muscle pain, diarrhea, or stomach pain. Other symptoms that people have reported include fatigue, shortness of breath, brain fog, and anxiety, according to Dr. Natalia Covarrubias-Eckert, medical director of the Post-COVID Rehabilitation Program at Providence St. Jude Medical Center in California. And finally, do you have to have had a bad case of COVID to get long COVID? According to Dr. Covarrubias-Eckert, the answer is no.
We are seeing it throughout the spectrum.
But Johns Hopkins Medicine and the CDC say long COVID appears to be more common in patients with initial severe illness, though it can affect people who had mild symptoms too. With your Verify, I'm Ariande Till.
And some encouraging news for those vaccinated against COVID. New data shows those under age 60 who are up to date on vaccines are very unlikely to become severely ill with COVID. The data obtained from New York State's largest health care provider found 80% of those hospitalized for COVID were over the age of 60. 90% of them had underlying health problems or were not up to date on their vaccinations.